Hello, my name is Regina Teresa Gates Green. I am a student of the Introduction to Counseling taught by Dr. Scalin at Laternal University. I will be speaking on psychotherapist Aaron T. Beck, and the references that I will be using today are psychologistanywhereanytime.com, Perceived Limitations of Standard Cognitive Therapy, a consideration of efforts to revise Beck's therapy and theory by David A. Clark, Journal of Cognitive Psychotherapy, and also a scholarly article in the Journal of Consulting and Clinical Psychology, 1993, Volume 61, Number 2, page 194 through 198, Cognitive Therapy, Past, Present, and Future, by Aaron T. Beck. Aaron T. Beck is a psychiatrist and professor at the University of Pennsylvania. He's actually professor emeritus. Beck was born July 18, 1921. He's known as the father of cognitive therapy and the inventor of the BDI, the Beck Depression Inventory, the Beck Hopelessness Scale, and the Beck Anxiety Inventory. Beck attributes the development of his theory to an incident he experienced as a child which left him with feelings of inferiority and incompetence. Beck says he taught himself how to work through these fears as a young child and problems that he had as a result of the fears and the anxiety cognitively. He worked through them cognitively, which basically means he did a lot of reasoning in order to get to a place of positive thought instead of the negative thoughts. This sparked his cognitive theory and therapies years later. Cognitive therapy is based on the fact that emotional and behavior reactions are learned. So if they have been learned, they can be unlearned or replaced by more positive behavioral reactions and emotional thoughts and feelings in place of the negative ones. One of the many definitions for cognitive therapy encompasses structured, time-limited, problem-oriented psychotherapy aimed at modifying the faulty information processing activities evident in psychological disorders like depression. Cognitive therapy considers an extensive amount of test of thoughts and emotions that one may have as a result of a trigger incident for, say, depression, which leads then to the therapist working on treatments and prescribing them to the patient for realignment of the thinking with what reality really is. Cognitive therapy most closely aligns with the scientist-practitioner model of clinical psychology, in which practice and research is performed from a scientific, empirical perspective. There is a clear focus on the issue and the measuring of the severity and other attributes of the issue against measurable improvement and goal attainment in the reversing of the negative thought patterns and whatnot. If we take a look at the article that Aaron T. Beck wrote called Cognitive Therapy, Past, Present, and Future, he speaks about how strongly he feels the importance is of having empirical data drive the creation of the treatments and also the measurement of how much better a person has gotten based on the treatments that have been given and the therapy. He speaks on the first page, I conclude that cognitive therapy has fulfilled the criteria of a system of psychotherapy by providing a coherent, testable theory of personality, psychopathology, and therapeutic change. A teachable, testable set of therapeutic principles, strategies, and techniques that articulate with the theory, and a body of clinical and empirical data that support the theory and the efficacy of the theory. He goes on to say, there should be empirical evidence to support the principles underlying the therapy, which should articulate with the techniques. The efficacy of the treatment should have empirical support. In retrospect, he says, I added that the system should include a tenable theory of personality and of the process of change. Although there have been many definitions of cognitive therapy, he says, I have been most satisfied with the notion that cognitive therapy is best viewed as the application of the cognitive model of a particular disorder with the use of a variety of techniques designed to modify the dysfunctional beliefs and faulty information processing characteristic of each disorder. So as you can see in what he writes, he really feels strongly, believes strongly that you have to use empirical data based on what you've learned of the person's disorder, how deeply the person is feeling negatively, and how at what depth the person has a disorder. You know, on a scale of 1 to 10, are they a 4, are they a 5, and what defines that 4 or that 5? Once he gets that, then he takes that information and matches it with a therapy or a technique that will help to erase or reverse the level of disorder that is going on. For instance, Beck sees negative thoughts and depression as one or more of 3 areas. 1, negative view of self. 2, negative view of the world. 3, negative view of the future. Beck calls this the cognitive triad. The depths of these negative views are measured using the inventories created by Beck mentioned earlier in this presentation. Exercises in reframing of the patient's thoughts, beliefs are then applied in therapy, which includes homework for the patient to complete as a form of self-discovery and application. Throughout the therapy sessions, the therapist measures improvement based on observation and analysis of therapist-patient interaction. Though there are many supporters of cognitive therapy, there are others who see drawbacks and criticisms of cognitive therapy, and here are a list of the most popular ones. Cognitive therapy has a limited view of emotion. In that, this article, Perceived Limitations of Standard Cognitive Therapy, explains that from a cognitive therapeutic standpoint, emotion is not necessarily seen as its own separate issue. Having an emotional problem, it's not seen as its own separate issue. It's not seen as something that necessarily needs to be treated. What needs to be treated is the thought pattern that brought you to that emotion. And if that thought pattern is changed and you are thinking from a realistic perspective as opposed to a self-defeating one or one of any negative thought that isn't reality, after you have applied that thought over and over again, at that point your disorder diminishes and goes away. There really isn't as much focus on the emotional aspect of what is going on with you. The next thing that detractors state is that cognitive therapy ignores the importance of social and environmental factors in theory and treatment. For instance, if a person were to come to a therapist that does cognitive therapy, they may mention that they are depressed. It may register on the scale as being a deep depression, but there will not be any therapeutic treatment that would be offered to the patient that would, in effect, address the social or environmental aspects of why that depression may have occurred. The other detraction is that cognitive therapy pays little attention to the therapist-client relationship. Therapist adopts the role of teacher, educating clients to the cognitive model and training them to identify maladaptive thoughts and beliefs and teaching them new thought patterns. Critics believe that the relationship of a therapist and patient in cognitive therapy, if that is to be the therapeutic way of treating the maladaptive thoughts, they feel that the relationship should be more equally balanced, that it shouldn't be a teacher-student role, that it should be more equally, we are in this together to work through these issues and find resolution and get you to a goal achievement of returning back to a normal mental state. The last detraction has to do with cognitive therapies, what is thought to be the overemphasis of conscious, controlled processing by the patient with no acknowledgement of emotions and thoughts that may be in the subconscious, therefore being inaccessible by the patient to communicate for measurement by the therapist and treatment. In spite of Beck's detractors, his cognitive therapy and treatments remain highly popular for relief from several mental ailments, including depression, anxiety, and even eating disorders. He continues to train therapists and provide treatment alongside his daughter, Dr. Judith Beck, at the Beck Institute in Pennsylvania. For more information on the Institute and Beck's techniques, go to www.beckinstitute.org. This concludes my presentation. Thank you very much.